Well, it's that one activity or the one thing that all of us do all our lives, right, from birth to death. So we breathe about 10,000 liters of air every day. And what do we breathe? Well, good question. Supposedly or supposed to be oxygen, but along with that, a whole lot of pollutants that are adding into the atmosphere every day. Thanks to you and me, vehicular smoke, very fine particles from construction all around us. And the list just includes industries and a whole lot more. So I'm not going to get into that, but we've actually reached a point where we need to worry about what we are breathing, because all those particles go into our system and are creating havoc. When I mean havoc, I mean just not breathing problems. It's just not a sneeze. It's just not a constant cold. It's possibly heart attacks and even strokes. That's why we need to care. Now, every Indian city is facing this problem. Now, where there is particulate matter, it's far more than permissible levels. And how do we fix this problem? So we're looking at solutions in our series Philips NDTV Breathe Clean.
Our air is laced with poison. 141 cities in India have particulate matter 6 times more than the permissible limit. Poor air quality causes premature deaths due to respiratory disorders. 1.3 million people in India die because of indoor air pollution every year. 80% of these deaths can be avoided. It is time for us to be the change. It is time to breathe clean.
I'm Ume Kulsum, and joining me on the show is a very eminent panel. People who actually are trying to raise awareness about this massive problem, people who are trying to provide solutions, and people who have their personal experiences, people who are trying to tell the government to wake up, people who are trying to tell you and me that we are both responsible and we can actually fix this problem. So joining us on the show, Mr. Kamal Mittal right here, environmental activist and someone who has a very personal experience and who's come up with a very innovative solution of trying to fix polluted air. There's Anumita Roy Chowdhury, the Executive Director from the Center for Science and Environment. We have Dr. Vivek Nangia, the leading pulmonologist from Fortis Hospital, and we have Jayadhar Gupta, the founder of Walk Masks. Also joining us from the US, Dr. Joshua Apte, who has done some extensive research on air pollution levels in India. Anumita, let me begin with you. With all the research that you have done, why are we talking about air pollution now? Why haven't we been talking about it at the same level or at the seriousness we should have done maybe 10 years back?
You know, I will answer that question a little differently. It's that what you see today is a much higher level of awareness and, more important, an international glare on the problem. Somewhere along the line, the problem has been globalized and there's a lot of international attention, there's a lot of buzz around it. If you look back 15 years ago, what has happened in Delhi and what we call the first phase of action to clean up the air of Delhi, when we shifted out polluting industry, we shut down power plants, we introduced CNG program, that happened because there was public anger in this city. The solutions that are needed for the problem today need public support and public awareness.
Dr. Nangia, let me come to you. So we're talking about fine particles here that people, we don't see the black smoke, but you do see a lot of people coming in with related problems, various kinds of problems, and it's just not a sneeze, it's just not a cough.
Sure. So basically, you know, what we're noticing now is that, of course, there's this long list of diseases that can actually be attributed to this environmental pollution. The common diseases are asthma, chronic obstructive pulmonary diseases, which is called the COPD, chronic bronchitis, emphysema, then lung cancers, respiratory tract infections. They've all gone up significantly.
Well, I became allergic to Delhi's air in mid-90s, and the air quality was horrendous at that time. And I had a choice of leaving Delhi, and I started thinking, where should I go? And that was the discussion in our family. And at the end, I said, well, let me try and fix it if I can. And that's when the story began. And I was on the board of IIT Delhi, and I went there in one of the board meetings wearing a mask, and I said, you need to help me. I've not charged you a fee for attending meetings. Now it's payback time. You've got to do something for me. So all the heads came, and we started doing library research and found that NASA was doing some work to put people on the moon and space stations and grow their own oxygen. So I started thinking as to what the solution could be. Why did Lord Buddha sit under the Budh tree and not under a neem tree? Why is there a tulsi plant in most Indian homes? Let's start with that. And in research, you're lucky or unlucky. As far as I'm concerned, we were lucky, and we found 3 plants. One to convert CO2 into oxygen effectively during the day in sunlight. One at night, call it the bedroom plant. Another plant which removes VOCs like formaldehyde, benzene, trichloroethylene, and a little bit of toluene also.
Right.
So we got these 3 plants, and we were very happy. So now we found solutions with mechanical filtration plus the plants, and at the same time reduce energy. So most people think it's a very expensive proposition, but we actually save money.
So we also have Dr. Joshua Apte, who's joining us from the US. Dr. Apte, you've been hearing this discussion, and you've been out on Delhi streets. The one thing good is this is a homogeneous problem. Rich, poor, young, old, everyone's facing it. Politicians, no politicians, all of us are facing it. Do you believe that our government is doing enough about it?
Well, if you look at the levels of PM 2.5 in Delhi today, those are the fine particles we need to care about for health. The concentrations on average in Delhi over the year are about 150 micrograms per cubic meter, or about 15 times higher than what the World Health Organization says is a safe limit. And what this means is that this is going to be a very long-term project to improve air quality in Delhi. The important thing is to make progress on as many fronts as possible.
You know, we spoke about awareness, and we spoke about the strides. So I'm one of those reactive Indians who got caught unawares. I was training for a half marathon and running in the morning, and you know, feeling great. You know, you're running, toxins are coming out, you're at the peak of your health, and suddenly I was smacked by, you know, whatever it was in the air, and my lung function dipped by about 60%. And I spent about 10 to 11 months chasing medicine, chasing science to find a solution, to find out what was wrong with me. And then I came across you know, an expat wearing a pollution mask. And you know, I was so tired of nebulizations and antibiotics and anti-allergies that I was willing to try anything.
Right.
And I adopted this mask, and it was amazing. It was like magic. 3 to 4 weeks, and I was completely clear, and you know, went from feeling 70 years old to feeling my age all over again. I think I'm just really pleased at the decibel levels. I'm pleased at the levels of awareness that we've reached. I think there's still a long ways to go, though.
Okay, so I'll take it on that all of you say that the level of awareness has gone up. All of us, we're talking about people here, do believe that there is a problem and that needs to be fixed. How are we going to fix it at a macro level, and how are we trying to make changes at a micro level? We'll discuss that right after this break.